One of the big benefits to living here in Portugal is access to the public health system. It's totally amazing to think that if you get some sort of life-threatening illness that you won't be without health coverage no matter what. You're going to have access to the public system. There are benefits and drawbacks to the public system, and there is private insurance that can supplement the public health coverage. So in this section of the course, I'm going to go over the public system, how to register for public health care, and some of the private insurance options that are available to you. Now remember, when you first arrive in Portugal, you're still not a temporary resident yet. It's not official until you have your CEF interview. After you have your CEF interview, you'll become a resident. They give you a piece of paper at the CEF interview indicating that you're now a temporary resident, and your temporary resident card should arrive in the mail within a few weeks. Once that temporary resident card arrives, you can go to the Centro Saúde, which is the health center in your municipality. It's very, very important. You have to go to the Centro Saúde in your municipality. So you've got to show them your address of record. And that's where you're going to get your numero utente, or your help number. When I went, it was an incredibly easy process. It took 10 or 20 minutes. You go in, you provide them some documentation, your proof of address, you provide your residence card. I believe I also needed to provide my passport. And they give you a piece of paper with your help number on it. Your help number is your numero utente. You are not given a card like a Portuguese person. You're simply given the piece of paper. A card is not going to arrive in the mail. This is the only record of your numero utente that you have. So definitely keep it in a safe place. What I do with mine is I took a photo and I upload it to cloud storage. So you can do the same thing. You can scan it, you can take a photo, and it's incredibly easy. It's something that you're going to want to always have a record of. When you are assigned your numero utente, you're also likely to be assigned a doctor within the Portuguese public health system. If you are assigned a doctor or not will largely depend on the availability. There are times when they simply don't have doctors available, in which case you're still going to have access to public health care. You just may not be assigned your own personal doctor yet. When you want to make an appointment to see your doctor, you go back to that same Centro Saúde. However, you do need to bear in mind that it can take some time. Usually it's taken me about 4 to 6 weeks when I want to see a doctor there. Now, how much you pay also will vary. I've gone to the Centro Saúde and I've been charged €4.50 to see a doctor. I've also been told at other times that I need to pay €35. This isn't dishonesty on the part of the person working there. Portuguese people have social service numbers that we don't have. And sometimes that just creates a problem in the system and they're unable to get you the rate that you should be paying as a resident within Portugal. However, if you are persistent, usually they're able to sort that out for you. For me, I look at it as I'm very fortunate to be here. I have access to something that I didn't have access to back home with public health care. So if I'm asked to pay a little bit more, I simply pay a little bit more. But that's a decision that you can make when you're at the health center. As far as appointments go, I prefer to go through the private system. I do find the public system is really good for things like physicals and lab work. However, if you just want to see a doctor, usually having private insurance and accessing the private system, I find it to be better and more convenient. One huge advantage of the public system and having a numero utente is the discounts on prescriptions. So this is something, even if you're at a private doctor, you give them your health number and you tell them that you're on the public healthcare system, and they'll put that in when they write your prescription. Now, there's a maximum under the public healthcare system, that a maximum price that can be charged for medications. So to give you an example, I take eye drops for glaucoma. In the United States of America, they cost $220 per bottle, and a bottle lasts me less than a month. In Portugal, without insurance, I pay €15, or around $17 or $18 for the same eye drops, not generic. With the public health system, I pay €1 for those eye drops. So $1.20 under the public health system for what cost me $220 in the US. So there are tremendous advantages to being on the public health system.